Hey guys, welcome to Alpha Physio Pelvic Care. My name is Anastasia Ovarova. I'm a pelvic floor physiotherapist in sunny Cyprus. And today I would like to talk about a very important topic that I have also seen through my work and through experience. I would like to talk about how we can help people with multiple sclerosis to get best result, best engagement of the pelvic floor through exercises. So I will show you a couple of tips and tricks today how you can incorporate pelvic floor and try to get maximum benefit of the exercise if you suffer from multiple sclerosis. So just a few words so you're aware. Maybe you do have multiple sclerosis, maybe you are suspected, not yet diagnosed, or maybe you're someone who is just interested, or maybe somebody from your loved ones, friends and family suffer from multiple sclerosis, so you can pass this information on. So multiple sclerosis is a disease when your own body destroys the myelin sheath surrounding the nerves. So basically it's an insulation around the nerve fibers to make sure that the signal that goes from the brain to the nerve is staying in that fiber and is passed where it's necessary, whether it's moving our fingers, blinking our eyes, breathing, and so on. Unfortunately, when the myelin over the time gets destroyed, the signal doesn't become so insulated, so it can kind of spread and become more vague, so it doesn't reach its destination, let's say, as intended. And quite often, like if you just do a simple Google search, multiple sclerosis, and the first thing will be a list of different, the word came out of my head today, signs and symptoms, right? Different signs and symptoms. Usually it can be fatigue as a general sign and symptoms, numbness, tingling, stiffness. Really depends on the person, really depends on the type, really depends how progressed it is. And I really don't have time to dive into it because it's a really vast topic. But you will see also in that list bowel and bladder problem. And this is what I have seen many times in my patient with MS. Sometimes these people do have visual symptoms, so if you look at them visually, you can see that their movement is a little bit slower, one side is a little bit weaker, so it's visually apparent. Sometimes visually these people might look absolutely fine until you start to talk to them and they talk about their symptoms. However, all of them, whether as they present visually with the symptoms that you can actually see or don't, have weaker pelvic floor. Quite often they will struggle to engage the pelvic floor. When I do examine those people, and it will be intravaginal examination for women, intrarectal examination for men, these people will struggle to contract, or they will say that I'm trying my best, I'm really directing all my effort to engage my pelvic floor, and it's either nothing happens or a very tiny bit of contraction, very vague contraction. And often these people are given a lot of exercises to strengthen their limbs, to strengthen their core, to improve their mobility, and pelvic floor is some kind of forgotten. Maybe because they never mention it, maybe because they don't yet have any bowel and bladder problems. Excuse me. However, sooner or later, unfortunately, these people might come across incontinence, stress urinary incontinence, even fecal incontinence. So today I would like to show you a couple of tricks that I use with my patient to get a maximum possible and to get to that pelvic floor as much as possible. First of all, I do explain to people what is pelvic floor engagement. We still try to do it, even just with the effort of the thought about it. Even if I get a little bit of flickering of the pelvic floor, it's still good. Anything is good than nothing. Second of all, these kind of people are good candidates for pelvic floor stimulation to help them to keep the bulk of the muscle, to keep the mobility of the muscle. And I can talk about it in the other videos. And if you are one of those people, or you know someone who is using electric muscular stimulation from pelvic floor, and if you suffer from MS or maybe other neural condition, please let me know in the comments. Today I will use two simple tools that I give to my patients, or they buy it themselves, to exercise the pelvic floor. And one thing I do, I cheat, or I teach people to cheat, and you will understand now what I mean. If you just Google simple pelvic floor exercises for general population, whether men and women, you will be asked to engage, contract, relax. But when a person lacks capacity to consciously engage, because there is not that signal going on, there is a damage to the nerve, sometimes we just need to engage and use all the other tactics that we usually say to people who don't have any issues not to do. People who don't have any issues, we say, don't squeeze your bum, don't tighten your abs, don't squeeze your legs together, and so on. So, which is logical, you know, we want to isolate that pelvic floor. When we can't do the isolated pelvic floor, first of all, we try the best we can. I do add cheating tactics, and it helps. It helps. Now, is there a great scientific base to it? No. Honestly, no. Is there a result for my patients? Yes. And I tell you something, it's not only about what they do, it's also feeling about their body, and it's also feeling that, yes, I'm capable and I'm helping myself. Instead of just dwelling on the things they probably cannot do, and maybe they will, maybe they won't be able to do. Let's face the truth. So you give them the tools where they feel that they're still doing something. They're still helping themselves, even if it's kind of not the highway to the pelvic floor, even if it's just a peripheral way, they're still getting to their point B. Two tactics that I use. Ball, squeeze, and it can be either hand squeeze or leg squeeze, or it can even be a pelvic squeeze. So I will show you this particular technique, exercise cheat strategy in laying down. It can be done in sitting, it can be done in standing. So what I do, I give them to squeeze the ball. The ball can go in between their knees. So what I will ask is to breathe in, to breathe out, try to engage pelvic floor as much as they can, as much as they feel, and add a good squeeze to the ball. Even if they will not have full pelvic floor engagement, the inner thigh muscles will help the co-contraction of the pelvic floor. Okay? So breathe in, squeeze, breathe out. Now, some people might find it too distracting for their legs. They might want to use the hands. As they use the hands, they engage the tummy and their pelvic floor. And it can be various exercises. It can be your one leg drop. It can be your one leg lift. It can be simply contracting your pelvic floor. As I said, it can be done in sitting on the chair. It can be done on laying down position on the side. Again, engage and squeeze. All right. So squeezing or between your legs. And this is not something that is an invention of America. These kind of exercises are quite often used for people with pelvic organ prolapse in the beginning of a rehabilitation of a post-pregnancy period. So these strategies, yes, they recruit your other muscles, but together you have much more chance on getting to those pelvic floor muscles, co-contract together with those body muscles. And sometimes I use the strategy of a pelvic tilt. So I let them lift here, place the ball, or maybe sometimes a pillow if ball is too high. And what I ask them is I ask them to gently press the ball with their low back and try to engage. What I must add here, I usually ask to do all these engagements under my direct supervision and internal checks. So I'm making sure these people are not bearing down. All right. So especially this one, the bearing down might happen. The bearing down will happen less in here and in here. Okay. If you are suffering from MS, or you know someone, or maybe you are treating people with MS, just to be 100% sure, because sometimes these people cannot give you exact feedback what is happening to the pelvic floor, internal exam by suitably qualified, experienced person, either gynecologist or pelvic floor physiotherapist. And this was tactics number 1. Tactics number 2 is no greatly different. We're using, instead of squeezing, we're using the opening against the elastic, against the resistance. One of my clients used elastic and she liked it the most. She preferred elastic and it helped her a lot. And she did all her pelvic floor exercises. Some of them were in laying down, some of them were in sitting. She did it with elastic. So again, just giving you an example in laying down. So breathing in, thinking about your pelvic floor engagement, stretching the elastic. It activates your whole nervous system. This kind of move, stretch the elastic. You can wrap elastic around your legs, make it quite tight, and maybe this helps you. Although you're going into stretch of the pelvic floor and some people struggle, but it might be tactics for you. So adding some adductors. And of course the favorite bridge and its variations where you do engage the glutes. And the people of the internet will shout to you, this is glute exercise, this nothing has to do with the pelvic floor. First of all, if you focus on pelvic floor engagement, you can make it a pelvic floor exercise. And second, people with MS who will struggle to engage the pelvic floor, they will get that co-engagement of pelvic floor, especially the back side of the pelvic floor, especially if they suffer from fecal leaks, so rectal incontinence, it will help them. So again, here we are putting a kind of the correctness exercise against the quality of life. My choice goes always to quality of life, even if we have to cheat around. I hope, guys, this was helpful for you. If you have more questions, if you want more explanations, please let me know in the comments. Let me know if maybe you are having MS. What are your strategies? What are your exercises? What are your cues? Please share in the comments, because this is very, very important. People with MS, quite often they feel isolated. They feel like they're going from one doctor to another. They cannot get answers to all their questions. So it's great to kind of share your experience so other people know. Thank you for your likes. Thank you for your subscription. If you enjoy my channel, make sure you share with people you might think this video will be useful, and we will see you very soon, guys. Bye.